All right, what we're going to talk about here is something that everybody, from pro athletes to your casual fitness guru to your casual jog a couple miles on the weekend, deals with, and that's this issue that we call shin splints. It's something that can really be debilitating from an exercise standpoint, causes a lot of pain right on your shin bone. That's why they call it shin splints. But it's something that's easily correctable. Brian's going to describe and explain to us how we can correct it.
Okay, there's really two different situations that we're going to deal with. There's a lateral or an anterior shin splint, which is actually on this side of the lower leg, and there's a medial or a posterior shin splint that's actually on this side. And the anterior lateral is a muscle called the anterior tibialis. Now the anterior tibialis is in this group here. Okay, it comes across over into here and it causes the foot to invert. Okay, now if you'll get a little bit of an indication if somebody has lateral shin splints. They'll come in and they'll be complaining of pain out in here. Now you can palpate and find find out the exact spot, or you can have them tell you where it hurts the most, which is what I would suggest. Just have them show you exactly where it hurts. And in a situation like this, anterior shin splints, there can be a number of predisposed situations that are causing the situation. You can be running on uneven surfaces. You can be increasing your mileage. You can be coming off an ankle sprain and afraid to push off and stay with your foot in a dorsiflex situation. So you're actually walking like this instead of rolling off your toe, which would cause your foot to stay in dorsiflexion for an extended period of time. The anterior tibialis will get extremely tight and you'll have problems in the long run. Okay, how are you going to handle this? Well, you can do a lot of the same things that we did with some of the ankle sprains, except you will come closer to the tibia. You'll just grab these muscles and then have him just take his foot in a little bit of a circle. Okay? It's just compression with an active engagement. Okay? You could strip these muscles. You can come in here and actually strip these muscles and start to clean this up. You'll get adhesion between one of the muscle groups we talked about in the ankle sprains, the peroneal muscles and the tibialis anterior. So you've got to free all this up in here and facilitate his, a properly functioning contraction in dorsiflexion where he's not having any pain. Now this is going to take an extended period of time. It's not one of these things that, hopefully you could walk in and walk out, but for the most part it's not going to happen that way. It takes a little bit of time, and the longer he's had this condition, the harder it's going to be, and the longer it's going to be for the condition to go away. You can get what's called a periostitis, which is the attachment site of these muscles to the bone. The bone gets irritated, and then you're not just dealing with a muscular issue, but you're dealing with an irritation of the outer skin on the bone. That's when things really start to take time to heal. Now, a medial shin splint is just going to be pretty much from the medial side of the leg, the exact opposite of what we were just dealing with. You'll fall right off the little shelf of the tibia, and you'll find the tibialis posterior. Now, tibialis posterior comes down around the medial malleolus and to the underside of the foot. It is also an inverter, so it will turn the bottom of the foot in. And what you're going to do is the same thing we just talked about. You can fall right off that shelf, compress, and then just have him take his foot in a big circle.
And again, what we're doing here is we're just looking for literally where the pain is. It's not hard to find. Like you said, Brian can start to poke around in there. As soon as I feel pain, he knows he's in the right spot. This is one of those things that's going to be very similar to treating the peroneals and the anterior side here, like we did with the eversion and the inversion on the ankle sprain. Now, one thing I want to maybe give you guys a little tip on here is something that we used a lot when I was dealing with this, is something that's called ice massage. And really, the best way to do that is if you can find a paper cup, Okay, fill it up with water and freeze it. And then what you do is you tear the edge around so you have just about half of the cup left, and then you've got about half the ice sticking up. And you can just turn that over and literally with ice, just kind of rub up and down here, rub up and down the peroneals. It's a technique called ice massage, but it's something that was very effective for me and a lot of guys that I know that dealt with this as well. Just another technique, something you can do at home if you don't have the ability to get to a physician or massage therapist. Something you can do at home along with just stripping the muscle yourself with some lotion, different things like that. This is definitely one you can treat at home if you know what you're doing. If you don't, you definitely need to go see a therapist. Mike or Brian here can definitely get that done for you.